Hi everyone, my name is Catherine Eubanks, and today I'm going to walk you guys through an issue that I feel super passionate about, but believe it or not, people don't think it's as important is pornography addiction. This issue has really been common, especially in this day and age with young people, and today I will be focusing on how it impacts their mental health and even their relationships from the behavioral health side of things. Pornography addiction is often really misunderstood. It's really not just watching pornography once or twice, but watching it to the point where it interferes with someone's life. It's not listed in the DSM 5 yet, but many mental health professionals they treat it similarly to gambling addiction because it affects the brain's reward system. What's really concerning to me is how early that it starts. Many kids are starting to explicit this content starting at age 11, which, and even sometimes earlier. But over time, what starts as a curiosity can spiral into something such as emotional distress, shame, or even broken relationships. If we look at how access to pornography has changed, I think it's pretty drastic. Before the internet, it took effort to access adult content. You would just go out and you would, watch it in person. But now, since smartphones and computers and laptops, it's all available 24/7 without any barriers or no supervision. And also, as far as we know, our culture since back in the day has shifted. Porn has become more mainstream, even normalized, and even memes and even pop culture. And while this might seem really harmless, it creates an environment where you don't always recognize their use as problematic, even when it's damaging their well being. Some signs that I found out that we should watch for include secrecy, staying up late to view this content, and then a noticeable interest in dropping in like the what we like to do in real life and even the people we hang out with in real life. Over time, people may feel detached from their partners or their family. And there's also a strong link to things like trauma, anxiety, depression. And for some people, porn is a coping mechanism, which is a way to escape pain or even boredom that they might be feeling in their life. But instead of helping, it can increase isolation and even stress. On the flip side, though, if you have supportive family members, healthy digital boundaries, and emotional education, this can reduce the risk. One of the most fascinating and also alarming parts of this addiction is really how it changes the brain. With repeated exposure, the brain becomes less responsive to the issue. So people seek out more extreme or taboo content just to feel the same level of arousal because honestly, they just get bored watching the same things over and over again. And this is known as developing tolerance. At the same time, people may begin to prefer the safety or predictability of porn over real intimacy, which can harm their ability to connect in relationships. Some even report sexual dysfunction, especially younger men, because real life experiences no longer stimulate them the same way that porn does. When someone tries to stop, they often don't expect how hard it is, just simply because withdrawal doesn't just mean a craving for it. You can have anxiety, irritability, sleep issues, and even physical symptoms like headaches, which we get all the time. But mentally, it's really tough too. People experience intrusive thoughts, really bad mood swings, and even trouble concentrating. And what really does make it harder is how easily people are triggered. Kind of like I said earlier, social media and being on our phone 24/7 is really a big thing. So just really scrolling through social media and even watching a movie can set you back into the pattern of watching porn, which is very compulsive behavior. Even when someone wants to stop, there really is a bunch of barriers. Shame and fear is probably the biggest barrier to quitting because often people they don't want to reach out to somebody for help. And there's also a lack of specialized training for therapists because many people really don't know how to treat behavioral addictions. It's just not such a big and new thing. And like I said, it's not in the DSM-5, but like this. It's not just psychological. We're kind of surrounded by devices in our everyday life that constantly want us to connect. When your biggest temptation is also your primary communication tool, I believe it's really easy just to fall back into that cycle. The consequences are definitely deeper than most people realize. Internally, many people lose their sense of self. They struggle with guilt and even identity confusion. In relationships, trust is broken, leading to emotional distance or even behavioral and betrayal trauma. Most people also lose motivation in school or work, depending on your age, whether you either miss deadlines, you have a poor time focusing, and even just being absent from it are even common. And socially, individuals may start isolating themselves from friends and family to hide this behavior because, like I said, they're ashamed. The longer I believe it continues, the more it affects the area of life. The good news is that recovery definitely is really possible. The most effective treatments that I found online is cognitive behavioral therapy, which reshapes thought patterns, and then even acceptance and commitment therapy, which helps people reconnect with their values. And there's also group programs that I found really interesting when I was looking online, like NoFap or Sex Addicts Anonymous, which provide a sense of community and accountability because you're not alone. Tech tools like this, like porn blockers and screen time limits, can help you manage temptation. And there's also some medications for it, like SSRIs, may be prescribed if there's an underlying condition like anxiety or depression. What usually doesn't work are shame based methods or just stop approaches. Like with any addiction, that's not going to help. Addiction is never just about the individual's willpower, it's just about how understanding and healing. So, these are my references that I used for this presentation. So, what are the takeaways? Pornography addiction, it is real. It impacts an individual's emotional, physical, and social health. It can rewire the brain, just like substance abuse can, and it deserves to be treated with compassion and not judgment from outsiders. If we can talk about it openly and support better clinical training and encourage people to seek help without shame, I think we'll be helping a lot of people heal because this really is a big issue. And we need to reconnect and build healthy relationships with themselves and others. And I appreciate you thinking and watching my presentation today.